With that, I'd like to turn it over to Stephanie Foster, Deputy Associate Director for Science in the Division of Environmental Health Science and Practice in the National Center for Environmental Health at the Centers for Disease Control and Prevention, who will share with us the priorities for today's workshop.
Thank you. Good morning. Thank you, Dr. Ness, and good morning, everybody. I am Stephanie Foster, and I am the Deputy Associate Director for Science for the Division of Environmental Health Science and Practice, the Centers for Disease Control and Prevention. But more relevant to today's workshop, I was the lead for the team that developed the 2022 guidelines for examining unusual patterns of cancer and environmental concerns. In a minute, I'll talk more about the impetus for this workshop, but first I want to mention the work that was done to revise the 2013 guidelines and agency roles. Next slide, please. State, tribal, local, and territorial health departments, along with cancer registries, respond to questions about unusual patterns of cancer occurrence in their area and have the most current local data. The federal role in responding to unusual patterns of cancer is limited. As needed, state, tribal, local, or territorial health departments may request technical assistance in response to unusual patterns of cancer from CDC and ATSDR. NCEH facilitates agency response to inquiries associated with cancer and environmental concerns by providing technical assistance in study design, analysis, and interpretation of the results when requested from our STILT partners. ATSDR offers technical support when requested to assist STILT partners conducting investigations of known environmental hazards. On occasion, NCEH and ATSDR conduct epidemiological investigations of cancer cluster concerns at the request of and in partnership with state health departments. Next slide, please. In 1990, CDC published guidelines on investigating clusters of health events, including non-infectious diseases, injuries, and birth defects. In 2010, CDC and our partnered with the Council of State and Territorial Epidemiologists to update the 1990 guidelines, specifically for investigations of cancer clusters. In the meantime, the Strengthening Protection for Children and Communities from Disease Clusters Act was first introduced in 2011 and reintroduced in 2013. The bill is referred to as Trevor's Law, named after Trevor Schaefer, who survived brain cancer at the age of 13 and who will be presenting later today. In 2015, the bill was rewritten to focus on cancer clusters. It was attached to the Toxic Substances Control Act Reform Bill, known as the Frank Lautenberg Chemical Safety for the 21st Century Act, and signed into law on June 22nd of 2016 by President Obama. Trevor's Law provides federal agencies with the authority to help conduct investigations of potential cancer clusters, undertake actions to help address cancer clusters or factors that may contribute to the creation of potential cancer clusters, and to coordinate with other entities and the public to investigate and address cancer clusters. CDC received funding beginning in fiscal year 2019 and continued through fiscal year 2022, specifically to update the guidelines, which we published in December of 2022. Next slide, please. When we initiated the process for updating the 2013 guidelines, we identified 5 key topic areas of interest with potential new methods and research that could be pertinent and informative. These areas include epidemiologic investigations of cancer clusters in community and residential settings. 2, geospatial and temporal methods, for example, defining non-jurisdictional boundaries of exposure, cluster statistical methods, statistical point pattern and area level analysis and interpolation. 3, rare event and small area statistical methods. 4, scientific advancements in cancer genomics. And 5, approaches for engaging, educating, and communicating with affected communities. Next slide, please. The process to obtain input for updating the 2013 guidelines was extensive, including a literature review, a STILT partner survey, focus groups with STILT partners and community members, expert panel forum, and stakeholder meetings. For 4 of the 5 topic areas, the various activities to gather input to inform the guidelines update were possible. The following key elements comprise the updates made to the guidelines. 1, proactive evaluation and routine monitoring of cancer data. 10, new criteria for evaluation and expansion of the cluster definition to address etiological considerations. New forms, templates, and communication resources, and enhanced communication and community engagement strategies. It is probably worthwhile to mention that the publication of the guidelines on the CDC website allows for future enhancements as science advances, and thus they are considered living guidelines. Next slide, please. As I mentioned, 4 of the 5 topic areas are addressed in the 2022 guidelines. However, when it came to scientific advancements in cancer genomics, it was not as evident. Next slide, please. As I mentioned, we conducted a literature review. We invited experts to share their work on mutational signatures and environmental exposures as part of our expert panel forum, and consulted with other subject matter experts, some of whom will be making presentations at the workshop today. The overall feedback we received during the course of revising major components of the guidelines was that when it came to genomics, the science wasn't yet there. In fact, one of our SMEs, subject matter experts, stated that while we are close, it may still be several years before genomics considerations could be incorporated into guidelines for use in community cancer investigations by our state, tribal, local, and territorial department partners. Our CDC ATSDR team believes it is still very important to continue our work in this area. Therefore, as a result of additional resources via congressional appropriations under Trevor's Law, we were able to support this workshop today and to continue our efforts to support some of the other components of Trevor's Law, particularly our work related to the Cancer Moonshot. Next slide, please. As I mentioned, therefore, the workshop priorities are to examine the state of the science of cancer genomics and environmental exposures, explore recommendations on the applicability of genomic research to identify and prevent unusual occurrences of cancer, particularly in pediatric populations, and identify gaps and suggest areas of future research that could be applicable to investigating unusual occurrences of cancer. Next slide, please. For more information about unusual patterns of cancer and the 2022 guidelines, please visit our website, www.cdc.gov, NCEH, Cancer Environment, CDC, CC Guidelines, or email us at ccguidelines@cdc.gov. Thank you so much.